patient selection, I mean, essentially this is following the licensed indications in individual countries for the use of Tisagen, because obviously it's a heavily managed resource. And as a result of that, then you often have to follow the eligibility criteria for your particular health authority or health service. Essentially, in the UK, we have a slightly expanded access compared to the ELIANA eligibility criteria. So we are able to treat patients under 3 years of age. With data that I presented at EHA, we've learned that that's sort of very favourable in terms of very similar outcomes compared to the older patients who were then treated on the ELIANA study, aged between 3 and 25 years. Other aspects of patient selection, essentially, because of the ability to provide CAR T cells, the fact that we know that there are acute severe side effects, but we don't see significant long-term side effects which are detrimentally affect quality of life, we are often phasing CAR T cell therapy for those patients who are either not fit to undergo a transplant, or certainly those that have undergone a transplant before. Those are the patients that we would prioritise for CAR T cell therapy. But there is a bit of a paradigm to try and introduce, where there is an eligibility that gives you access, to try and introduce CAR T cell therapy, if possible, before stem cell transplantation. And this is somewhat controversial, because in some cases it may be that the event-free survival is actually better for transplant. But if you have a poor donor, a poorly matched donor, or if you have a patient with comorbidities, then it may be that actually mitigating the toxicities of a transplant is important, as well as considering just the straightforward disease outcomes such as event-free survival. And so in the UK, we are trying to guide patients through our relapse guidelines to consider an approach that would put CAR T ahead of stem cell transplantation in those contexts, but also to mitigate the long-term late effects of transplantation associated with a radiation-based transplant, for example, fertility, and the other late effects that can trouble patients, including chronic GVHD. But whether that is valid needs to be tested, data needs to be collected to understand if that is the best approach, and that's the subject of much discussions and hopefully of randomised study designs in the future.